Welcome, Saratoga. Welcome to Saratoga Sunshine. Today, we are going to talk about the COVID crisis here in Saratoga, what's going on, try and give you some insights and information as to what we as a city are doing. And sort of a casual format today. I am Howard Miller. I am our city's mayor this year, and I'm accompanied by our city manager,
James Lindsay. Thank you, Howard.
And we have sort of an informal program scheduled for today. I'm going to start with some updates about what's going on in our community. And then we've invited members from our senior center to talk about the impacts on seniors and what we can all do to help. So let me start with a little tiny bit of basic information. The virus has been going on for a while. This has become all-consuming for many members in government and obviously everybody in our society. And so it's not the best of times. However, we remain one of the best cities. And so I want to remind everybody that a certain amount of patience and a certain amount of fortitude is what's needed at this time. So let me start with some data. Let me see if I can share this screen with people. Okay, hang on one second. Many of you probably are aware of this website. If you're not, Santa Clara County has a real-time dashboard that does provide pretty comprehensive data for what is going on within our county. As of yesterday, there were 20 new cases and unfortunately 3 deaths. They do show all the trends. There's actually a wealth of information available on this website. And if you are a data person, this website provides the most accurate data that's available within our county. So I want to point out a few good news things. The death rate within our county is diminishing, but very importantly, and it's due to our individual efforts, the new cases rate continues to decline. So not every day is down. There are always ups and downs in this, but overall, we are reducing the spread of this virus within our county. So if you are interested in this and more data, we strongly encourage you to do Santa Clara County COVID-19 web search, and you will find this particular website. So I also follow state news and national news. At the state level, the state of California is unfortunately still in a space where we are maybe just leveling out. And the best source of data that I have found is the LA Times COVID-19 page. I'll leave that for you to Google. Too much data may not be a good thing. But that website shows every single county, and it gives you the ability to search a lot of data about a lot of counties. Here's the good news. Santa Clara County's growth rate is down to doubling every 50 days. Longer is better here. And again, we've done a great job. The state has some challenges in Southern California. We are all aware of those. But I have family and relatives in Southern California. I think everybody's figuring this out. Everybody's doing their part. Nationally, it appears as though we have plateaued. I have relatives in New Jersey, and not all news is good. My aunt started palliative care yesterday in New Jersey. We are all going to be affected directly, indirectly, or through a friend by this unfortunate virus. But nationally, the United States is leveling out. Some areas are clearly declining. Some of the worst areas, New York and New Jersey, other areas on the East Coast, are getting much better. We're nowhere near out of the woods, but lots of positive stuff is happening. Internationally, there are some really bright spots. I have family members in New Zealand studying the situation there. They've been there for 9 weeks, and New Zealand appears to have turned the corner and is opening up their society right now. There are positive things going on around the world. So let me talk about some of the recent headlines in the news. And no, I am not going to repeat anything that I'm hearing in the news. I want to make first a couple of comments. When you go on the internet, there are a lot of potential cures and a lot of products that you could buy. And I strongly encourage people to only consider things that have been blessed by the Food and Drug Administration. Cleaning products are not going to help inside your body right now. For example, there are herbal teas and stuff that have no proven medicinal value. Be safe. Use things that have been approved or blessed by the FDA or under the consultation of your medical professional. I want to talk about some of the studies that are going on. If we read the news or follow the news online, you can get discouraged very quickly. My mother's a researcher at UC Berkeley in the life sciences for my entire life. And the way she would describe it, every research paper is when some very smart person has figured out how to get two pieces of a puzzle to snap together. And, you know, when I do puzzles, I'll snap two pieces together. And my wife will look at them and say, those don't even go together. And that's the way it is with research. And right now, everybody is so hungry for news and information. As soon as a research paper is put out in that draft form for peer review, it hits the front page of all of our papers. This is just two pieces of a puzzle that may fit together. It takes 100 pieces of a puzzle to see what the puzzle even is. So I don't want anybody to try to draw huge conclusions from individual studies that you see on the headline news in any given day. And there is one study that came out that I will make a comment on. There was a study that talked about very, very low survival rates for people that were put on ventilators. And I did the only logical thing that would happen in my family was I called the researchers and family members who were working in the wards at Johns Hopkins. And I said, is this really true? And they said, no, Daddy, this is totally false. We have here at Johns Hopkins, we have above 85% survival rate for those that have been put on ventilators. That's not what you heard in the top line news. The techniques of patient care and patient treatment are dramatically different now than they were just a month ago. And the leading universities in America, the teaching hospitals, are finding new and better ways every day to care for those of us who end up with this virus. And so I don't want anybody to walk away with one news article thinking really negative things. It's just a piece of the puzzle. As we get more experience and more knowledge, we will be better able to manage the healthcare situation. We will be better able to treat patients. Medications and viruses, those are things that are being explored by researchers now, and there is no one that I know that's expecting a silver bullet tomorrow. So what's our best line of defense? We all know that. That's preventing ourselves from getting it and preventing ourselves from passing it on to others. Okay? We've talked a lot about social distancing, and I want to just back up and talk about the basics, right? This virus transmits primarily through your body, mouth, nose, eyes. They talk about mucus points of entry. And what does that mean? Well, we say don't touch your face. Yes, please don't touch your face. Whether you're wearing gloves or not wearing gloves doesn't affect it. What is affecting it is whether or not you're touching your face. So if you go out, in our family, we have one designated shopper, and that's me. And when I come home, the first thing I have to do is wash my hands thoroughly with soap, both sides. We all know the procedure. I'm reminded constantly not to touch my face. And I have my favorite mask that my daughter sewed me. She's also given me the official Johns Hopkins designed masks. You can purchase masks, you can sew masks. If you can't sew a mask, you can always contact my daughter, she'll sew one for you. We wear masks to reduce the possibility that we may be spreading the virus and to reduce the possibility that we may be contracting it. That's through the airborne particles. Also in that vein, we ask everybody to stay 6 feet apart. None of the things that I've mentioned is an absolute bulletproof defense. These are all part of the steps that we can take to keep ourselves safe and to keep others around us safe. And for the youth, my daughter is one of them, I want to remind people, just because you may think that you don't have this doesn't mean that you don't. And it's unclear, all the transmission vectors. And so we do ask people, even though it's not our official rule within the county, we do ask people to wear masks when out in public. And we do ask people to respect the distance. 6 feet would be the minimum. And personally, I advise everybody wash your hands when you go home. So let us talk about what's going on in the county. Everybody saw the pre-announcement on Monday by the mayor of San Francisco. Unfortunately, her pre-announcement was perhaps a little premature. There was no underlying information about what's going to change. This afternoon, well, noon today, we are going to get the official updated shelter at home orders from our county. We all know the punchline. We're going to be doing this for the month of May. However, they have looked at a lot of job functions and a lot of things that are going on. And so the silver lining should be hopefully positive for some people. I'm expecting to see some adjustments that should make our lives a little bit easier and should allow some of the hardworking people within our community that could safely return to work to have an option to safely return to work. It's a 5-week period. I don't expect everything in the first day. I do expect positive news though. Again, I will leave us with we have done an exceptional job in Santa Clara County in flattening the curve. We have done what has been asked of us, and we have seen the results. There is a lower new case rate every day. And so we're not going to rest on our laurels, but there is positive news out here. So with that, let's talk a little bit about the city, James. The city is just affected by the shelter-in-place order as everybody else. So what's going on in terms of city services right now?
Thank you, Howard. As many know, City Hall has been closed for the past 6 weeks, but our essential and emergency services haven't skipped a beat and continue to serve our residents. Much of the staff here at City have been working from home, and we've had our maintenance crews coming in on staggered shift to ensure that social distancing could be maintained, but to ensure that the safety issues that prop up in our parks and streets are addressed in a very prompt manner. We do have information on how to report any issues on our city's website. So I encourage any listeners to please look at all of the resources and informational links that are there. And if you see any issues, do please continue to report them to us. As you can imagine, many hours have been spent closely coordinating with the county's efforts, County Office of Emergency Services, County Public Health, on the local response here and the implementation of the order here in Saratoga. And like you had stated, we're anxiously awaiting the update coming up here in the next few hours to see how life might change for us here in Saratoga.
Yeah, for everybody who's watching, we'll do another show on Monday to update everybody on how those changes will be affecting us here in Saratoga. James, I got a couple of specific questions that I've been posed. If people need a building permit, say for a roof that's leaking for a hot water heater, those basic things that are needed to keep your house functional, can they get one, and how do they do it?
Absolutely. No, home repairs such as replacing a hot water heater that's not working or fixing a leaky roof are all allowed under the county's order, and we have city staff that have been available here to assist residents in obtaining the permits to do those necessary repairs. Some of the criteria that the county uses under the current order is repairs that are needed to keep a resident safe, sanitary, and habitable, and cannot be delayed. And those are the criteria that we are using as we're working with community members to see if those are permits that we can issue under the current order.
So how did they get one? Do they go to the city website? Is that the first and best way?
Correct. We have really tried to set up the city website as your go-to informational source, and that will then drive you into the different areas that you have that are more specific. So on our building division's webpage, which you can get from our COVID-19 page, that shows you how to get those permits. Things are a little different because City Hall is closed, but we're still allowing those permits to occur and those inspections to happen. And all that information, again, is on the city's website.
All right. And then for those of us who want to get outside in the fresh air and the sunshine, what is the status of our city parks right now?
Open, open, and open. I am happy to report that they are all open. Restrooms are open. In fact, I encourage residents to enjoy all of our parks, even bring your own equipment. One caveat that, the members of your household are using the equipment, so we're not spreading any germs, but we are encouraging folks to be outside, getting some exercise, taking advantage of the trails. The playgrounds and the sports courts will remain closed for the time being until we can get some further direction from the county. But we are hopeful to see folks out there enjoying the open space.
Are our parking lots open?
The parking lots are open.
So we could all do a hike at Corey Park.
That's an excellent idea. It's a beautiful day for that.
Okay, great. Okay, there's more stuff going on in the city. There is a city resource page that is up. But if you just go to the city website, www.saratoga.ca.us, there's a COVID banner right at the top that you can click on, and it'll take you to all of the critical stuff. Okay, so moving on. Today's program was supposed to be senior focused, and we are joined today by Tylor Taylor. Tylor, if I think you can turn on your camera, and who is the Executive Director of our Senior Center. And then Lisa Oakley, who is the chairperson of the board for SASCC, our Senior Area Coordinating Council. Hey, Tylor. Hey, Lisa.
Hi.
How are you guys doing with all of this?
Hanging in there.
Hanging in there.
That is the word of the day. We're all hanging in there. We're doing our part. I gotta just jump right in here. This shelter at home order has impacted a lot of what we can do in the cities. Tell me, what is SASCC and what's our senior center doing to respond?
Well, so our senior center, prior to COVID-19, one of our initiatives was actually a larger AARP initiative called Age Friendly. And so our Saratoga Age Friendly programs have had to be put on hold, one of which was our walking group that met at West Valley College. Not only were they walking, but there were additional programs there and always lunch. The sheriff was working on a driver training program that's had to be suspended. That was also for our older adults. And our emergency preparedness workshops through the Santa Clara County Fire has had to be suspended. In addition, our senior center has had to close our doors physically, but only physically. So unfortunately, that's been difficult. We can't have in-person classes, and particularly for our older adult, our adult daycare program, we've had to close our doors to that. So we've been scrambling to figure out ways to help our most vulnerable in the adult care center, as well as our senior nutrition program, our ride transportation program, and this has resulted in some hopefully temporary layoffs of some personnel as well.
Give me some positive news. What are you guys doing that's positive to help?
Well, Howard, this obviously has given everyone an opportunity to try to see what they can do creatively to meet the need that's been created by this. And so some of the really positive things that we've been able to do is expand beyond our own walls and get out into the community virtually, as well as using our resources to meet people's needs in their homes. One great example of that is the RIDE program. As a lot of people may know or may not know, RIDE was a senior transportation program that was delivering about 6,000 rides per year to isolated seniors to get them out into the community doing whatever it is that they would like to do. When this crisis hit, people weren't taking rides anymore, other than to non-emergency medical appointments, which we still do. But we repurposed the program in order to deliver essential items such as groceries, prepared meals, pharmacy products, and so on. Pardon me. to folks in their homes. And so we were able to work with our partners in the county to get that change to our program approved. And they realized also that we needed to meet the need. Some of the other things that we've been able to do have been hosting online classes such as chair yoga, exercise, meditation. And I have just, and Lisa will probably bring up a little bit more about this, but we launched a resource line for seniors to call into with whatever needs they might have. Maybe Lisa can share a little more about that.
I can share it.
Yeah.
Now. Okay. So we just launched an online support program, which I'm super excited about because, as you know, we are isolated in our homes, hopefully with other family members, and it can be difficult though, especially if you live alone. A good friend of my parents lives alone, and you want to be able to connect with people. And so this support line, I want to give you the phone number, is 408-621-7526. And it is operating from 8 in the morning until 4 p.m. in the afternoon. And it's a great way to connect with somebody, whether it's, I'm feeling lonely and I need someone to talk to, or I'm running out of groceries and I have, because I'm an older adult, I might have some, compromised issues that I need some help to do that. My mother has dementia and I need to find a trustworthy caregiver for her. I'm a caregiver and I just need to vent to somebody or get some help in that regard. So the support line is available to everyone over the age of 65. And I'm very excited about it. It's a way for people to connect with someone else to get that support.
Are there other ways if people people want to connect with the RIDE program for food or something? Are there other ways to contact SASCC? How do they get in touch?
Well, we have a few different ways people can get in touch with us, Howard. One of them is in our newsletter, the Outlook here. It looks like it's backwards on the screen, but the Outlook is our community newspaper. What we do with that is we have a page in there for resources. When you flip to that section, you're able to see phone numbers, addresses, and information about different resources that are available. You can also go to our website, which is www.sascc.org. And there's a lot of resources there that are specific to the COVID-19 response, links to the county public health department page, and other resources that are available locally. The RIDE program, also, go ahead, Lisa.
I was just going to forget, they can access our newsletter on our website as well if they aren't able to get the physical paper.
Absolutely, it's downloadable. You can also view it on our site and scroll through it on the site as well. And you can also get in touch with the RIDE program at 408-892-9739. Our guy Joe will be happy to talk to you and tell you about how to schedule a delivery, or if you need a ride to a medical appointment, we can also take care of that for you as well.
Yeah, okay. This is great. These are opportunities within our city. I got to say, there's a lot of citizens within our community who want to help out. Are you guys, and many organizations aren't accepting volunteers right now. Are you guys in a position to be able to make use of volunteers within your organization?
Absolutely. With the RIDE program and with the delivery service that we're launching, we need drivers, and we do have a vehicle that was generously donated to us by the Paquier family and Fang Pei. They teamed up to provide us with enough funds to buy a brand new Honda Odyssey. And so we're using that in order to both deliver groceries and essential items to seniors in their homes, and also to provide the rides to the non-emergency medical appointments. And so we do need volunteers for that program. As Governor Newsom launched a senior nutrition support program through the local restaurants, more details are coming soon about how to access that and how to actually participate in that. But we'll be helping the local restaurants to deliver those meals to seniors, and we'll be able to put seniors in touch with the restaurants who are going to participate in that program.
Excellent. That is super good news. Okay, what about donations? Are you guys in need of any money?
Well, yes, we definitely could use the support in terms of financial and The main reason is what we're trying to do is we're trying to alleviate some of the cost burden for folks who have been out of work, whose support systems may be a little bit more pinched now than they have been in the past. And so we're doing things like gift baskets. We're doing masks for people. We're also putting in our delivery bundles, we're trying to create some care packages that consist of hand sanitizers, masks, gloves, as well as gift cards to help people kind of ease the burden. So any donations that the community is able to provide to SASCC at this time will be put to great use.
Excellent, excellent. How are you guys managing personally? You have the seniors of Saratoga to care for, you have your own families and yourself.
For us, Manny and I both have older adult parents. And so when we schedule where we're shopping on which days, so it might be Trader Joe's, and then it might be Safeway, and then it might be Costco. We gather the list from our parents. My dad sends me a text with his list, and we actually then meet my parents in the parking lot after we've done the shopping. Keeping our social distance, we put their bags into the trunk of the car and go on from there. We've also have my daughter and a friend of hers staying with us. And at first it was a little rocky because there's 4 of us all doing different work at the same time, trying to find a room that we can go internet connection to get that work done. But we found a system that's working really well for us now. So that part's going well too. I don't think we're any less busier. And I don't know about you all, but I feel like the days are flying by.
The days are long. Tyler, how are you guys hanging in there?
Well, Howard, I'm getting to know my wife in new ways. We're spending a lot of time together, and it's definitely a good thing. She's an exercise freak, and so I've definitely been having less and less excuses to get down on the floor and do some push-ups and do some yoga poses and get out into the woods and hike or to the hills and hike. So we've been taking some time to exercise and try to get a little bit healthier. But we're also kind of paying attention to what's going on around us. We both are professionals, and so we spend a lot of time at work. And for me, our team our remaining team is shouldering a lot more of the burden of the work these days. And they're really working hard to make sure that we have resources for our seniors. So I do spend a lot of time working still, but I've just been able to reflect, kind of take a little bit of a breath, and make sure that I'm keeping my family ties strong, connecting with my family by phone and by I've heard a comment from some people that they've spent more time with their family virtually now than they have in person for the past 10 years or so. So it's been good to reconnect and kind of find a space to reflect.
Yeah, that is true for all of us. It is a different time, and we're working in different ways, and some of our family members are appreciative, and some are a little less appreciative. But it's all working its way out. Do either of you have anything else that you would like to share?
I would like to share one more thing. A positive note for folks who have family members who are living with Alzheimer's, dementia, or other cognitive and physical disabilities, who might be in need of adult day program services. The most vulnerable in our populations were, obviously the most heavily impacted by this situation. The closure of our adult daycare program provided a big hurdle for a lot of people. And although some folks were able to stay home with the order, some folks are also essential workers. And so when you have a relative, a family member, loved one who is suffering from that disease, you know that it's not an easy thing to leave them at home, and it's also not an easy thing to manage and carry on for yourself. One of my other hats is I am on the Senior Care Commission for Santa Clara County, and we had just successfully proposed a budget item for $775,000 to support adult daycare programs throughout the entire county of Santa Clara. When COVID hit, all of the adult daycare centers closed, and that funding was being threatened by the budget cuts that are going to be subsequent to the response by the county. We talked to all of the Board of Supervisors and the staff in the County Office of Contract Management, the County Office of Research and Evaluation, and we were able to demonstrate to the county that there is a way to provide those services remotely. We can get in touch with families through meetings just like this one, and thank you, Mayor Miller, for putting this on, and the city staff. We can provide caregiver resources for families remotely. We can provide counseling sessions, and there's just a lot that we can do from using technology and also the old-fashioned ways of phone and mail. And so the county allowed us to keep our contract intact. And what that means is we will have funding from them to provide our adult daycare services remotely. And folks who may not be able to afford those services in the past, there is a subsidy available for you. So if you have a loved one, a relative, a parent, a husband or wife who may have Alzheimer's or dementia, or may have some cognitive impairment, and you need some resources and you need help, there is a program available for you. If you reach out to us at www.sascc.org, and I think they'll put the link on at the end of this.
I got it, yeah.
Yep, you'll be able to get in touch with us, and we can provide some services for you at little to no cost. So please take advantage of that, and that's one of the great things that we're really excited about.
Excellent. Okay, we are about out of time here, but don't move. What I'd like to do is I have a slide that has your website on it, but I want to go back through all the phone numbers. So first, let me go back to that slide. And if you guys could please, several phone numbers were given out. Lisa, you had one. Tyler, you had one. If you guys could repeat those phone numbers twice. First, on the website here is the official website for SASCC, Saratoga Area Senior Coordinating Council. On their website, there's a COVID link right on the top. There's a lot of resources. Everything that we talked about today, for the most part, you can find there. But in addition, you guys mentioned some phone numbers. So if I could get you guys to repeat them a couple times, that would be great.
Absolutely. So the support line, which any of our resources can be reached by calling the support line. So even if you forget the email address, you can access it through this phone number, which is 408-621-7526. Again, that's 408-621-7526.
Excellent. And there was a ride number?
Yes, the ride number is 408-892-9739. Again, that's 408-892-9739.
Excellent. Okay, Lisa and Tyler, I really want to thank you for joining us this morning. Good stuff happening in our seniors, for our seniors, through our senior center and our senior council. You guys have been wonderful. It's a trying time. I will point one small thing out. The city is working on our budget right now, and up for discussion are ways that we can help to support the businesses and the seniors within our community. And so we will be in touch as we work through those processes here at the city.
Thank you very much, Howard. And I also want to thank James, Crystal, and Lauren. Your team there at the city always does a fantastic job, and we really appreciate the support that everyone in the city of Saratoga shows to its seniors. It's a example of leadership. Thank you.
Absolutely. Thank you. I repeat that same sentiment. It's wonderful. We greatly appreciate you all.
Thank you guys for being here today.
Thank you.
So I want to take a minute. I want to talk about other opportunities that are going on and provide a few more resources. Within our community, the primary provider of food bank services and rental assistance and utility assistance within the West Valley is an organization called West Valley Community Services. Many of you are familiar with this organization. They are, at this moment, serving an unprecedented number of people in the West Valley, including many here in Saratoga. They continue to operate the food bank at West Valley College in a slightly different way on Wednesday. At this point, they are not taking volunteers, but I will say they are in need of financial support. Many have donated food to this organization, and that is still something that they need. But right now, it is much more efficient for them to buy a pallet full of spaghetti and rice than it is for us to donate spaghetti and rice a pound at a time. Now, if you have fresh lemons or fresh fruit that you cannot consume in your house, they would love to get fresh fruits and vegetables. But beyond that, their number one need right now to help serve the citizens of the county and of the West Side is financial support. So I have their website here. Below them is another organization, foundation that has been super critical in serving the healthcare needs within the county. We have the Valley Medical Center, which is operated by the county, but they have a foundation, the Valley Medical Center Foundation. This provides all the extra stuff that a hospital needs. And in this time, they have been pressed into helping to supply hand-sewn masks, face shields. They are the organization that is taking donations to purchase additional equipment and additional emergency supplies. And they are in the same situation. They have limited opportunity for volunteers. And while they love hand-sewn masks, at this point, they would rather be in a position to buy specific new equipment that is needed within Valley Medical. And so if you are so inclined, this is another opportunity to donate to help financially support a donation within our city. And then the last one is our Saratoga Chamber of Commerce. We meet with them, seems like weekly, since this is broken out, a lot of contact and a lot of concern for the businesses within our community. This is a very, very trying time. But our Chamber of Commerce has compiled a list of all businesses that are open through this period, not just chamber members, but all of them, and some information. A lot of our restaurants are doing grab and go options. Some of them are providing delivery options. And while not every meal can be gotten from outside the home, and in fact, for some of us, we prefer to stay in as much as possible to prevent spreading of any germs, supporting our local businesses at this time is super critical. So if you are so inclined to want to get a nice restaurant-made meal and bring it back home, the best way to find those resources is to hit our Chamber of Commerce website, and I have them listed here as well. So, and then in terms of resources within the city, we have set up, again, if you hit the main Saratoga website, there are a COVID banner at the top and there's opportunity. But we have compiled a resource page, which we are continuing to populate with important information and links for the citizens of our city. If we're missing something or something you know about, please feel free to email me or city staff. There's a feedback opportunity on this website as well. And then as for this forum of communicating with the city, today was our first attempt, and it is our plan to be back on Monday with much more definitive information that comes out of today's order. And James, is there anything else that you'd like to add on behalf of the city?
No, just a big thank you for the community. I think Saratoga has really come together, and through our community partners like SASCC, we just are very, very thankful for everybody's patience, their flexibility, and your continued diligence as we all work through this together.
Excellent. Okay, Saratoga, thank you for spending a little of your morning with us. Keep positive and keep doing the great things that you're doing.